Good evening. I want to thank all the executive of CMDA here present. I appreciate the honor you have given me to present in today's webinar. And thanking God for the opportunity. Today's topic is TELE-DENTISTRY, expanding the access to oral health care. As earlier introduced, I'm Dr. Moninuola Ernest, a consultant orthodontist at University of Ilorin. I'll go ahead to the introduction. Digital technologies are becoming essential to oral health and optimize the suboptimal importance of healthcare systems. TELE-DENTISTRY involves the use of information and communication technology in order to be able to improve access to oral health care and the quality of oral health care delivery. The other terms that have been used for TELE-DENTISTRY, some have said e-oral health, virtual oral health care, telemedicine oral health, home oral health care, and mobile oral health care. But basically, all is just talking about TELE-DENTISTRY. So, what is TELE-DENTISTry? TELE-DENTISTry refers to, number one, the use of information and communication technologies for the transmission of clinical information and images. And this can be done between an oral health professional and the patient, or between two health professionals. At least there should be one oral health professional. But one main quality is that these are separated by distance for dental consultations, diagnosis, and treatment planning. So the main thing in TELE-DENTISTRY is that it is not an on-site thing. The provider and those who are accessing treatment are at different distance. Let's go to the history. Historically, the initial concept of TELE-DENTISTRY was developed as part of the blueprint for dental informatics. And this was drafted at a 1989 conference that was funded by Westinghouse Electronic Systems, Baltimore, that's in US. And in that conference, the focus was on a discussion on how to apply dental informatics in dental practice to directly affect the delivery of oral health care. So this graphically just shows us what e-health is. There are different components of it. You have the clinical decision support, you have the health record where you collect all the information and the data. You have the research and data collection. You have patient registration or scheduling. You have telemedicine, patient evaluation, patient monitoring, tracking, and reminder. You have the laboratory, pharmacy, information management. So all this encompasses health. This is a simplistic model demonstrating telemedicine. Patient is at home at a remote site. This is the practitioner in the hospital. Patient sends information to the cloud. Agent, but the hospital receives the information from the cloud and is transmitted back to the patient, either for prescription or to be referred for on-site evaluation. Okay, this also graphically explains it. Here is the patient. Then there's a server, either a phone or a desktop. There's a server that is connecting the patient to the dentist that is at a remote site. The patient consent has to be gotten, explanation has to be made, and there has to be a medium that will transmit that information. And what is the relay? Dentist, diagnosis, treatment plan, prescription, referral, further tests, further advice. So there's that information exchange. And from that information exchange can either be just prescription alone, or just drawing treatment plan, or there might be need to refer to the dental care where the patient will have evaluation on site. Or if it doesn't need that critical care, everything can just end here. Patient is given prescription, patient is given counsel, oral health education, and it ends there. This also graphically illustrates it. Patient is using a suitable tele-dentistry program. There has to be a medium of passing the information that patient uses. So there's a connection to a dental provider, then patient registration to the tele-dentistry platform. Patients, there's upload of photos, videos, X-ray records, that platform. And this is received at a remote site by the dental practitioner. The data is received by the dental practitioner. Information is stored in a secured server. And this is important because, patient information has to be kept secure because it's not something you want to take out for legal issues. Then there's connection of expert consultants, depending on what the diagnosis is. And from this, the dental professional gives teleconsultation to the patient, either prescriptions, counseling, or referral for on-site care. So what are the components? In tele-dentistry, you can have real-time consultation, live video, which is synchronous. There's real-time video calls for immediate interaction. So the patient directly interacts with the provider in a remote site through video calls. So there's immediate interaction, there's screening, and there's planning. So all this is done between the dentist and the patient, and that they are in different places. The patient might be at home, very far. Also, another component is that there's storage and forward. This is the asynchronous. Securely sending photos, peripheral x-rays, all the other radiographs that have been done, and then videos that can later be reviewed. That'll help in the management. So there are also mobile health apps using smartphones and health apps, virtual care delivery. And then even for those on chronic treatment, for those on long-term treatment, there can be a remote monitoring, collecting patient data from a distance. Like sequentially monitor patient progress. So tele-dentistry has been used in the context of dental education, training, and transfer of information, or for the delivery of oral healthcare services. So it's not just about patient management alone. It can also be an avenue to educate patients, educate the dentist, and also an avenue to transfer information, and they can be an avenue to train other dental practitioners. It involves the interaction between the oral healthcare practitioners and their peers, or with other healthcare providers, or with their patients and or caregivers, to be able to improve patient outcomes and the quality of care. And this is important. When in later slides, we'll see the number of dentists we have. We have a lot of dental surgery technicians, and these are being churned out. There are thousands in Nigeria now. And because they're not recruited to us, so many of them are just opening back dental clinics and practicing some things that are outside their boundary. So tele-dentistry can be an avenue to really give these ones education so that they know what is their boundary, what they can handle, and what they need to do. So what are the benefits of tele-dentistry? For patients, it's faster consultation. Some patients come to the clinic as early as 7 a.m. and they may not be seen until 5 p.m. But with tele-dentistry, just a click of your phone and I have faster consultation. Also, there's improved access. It reaches undeserved populations that are remote areas. In our experience here, there's some patients that come all the way from Barutin, a journey of like 4 hours, just to be able to access dental care that will not be more than 10 minutes. So using daily dentistry will also improve access. Then it's convenient, it saves time and travel, not the cost of travel now, the security challenges. So it's a tool that is really apt that we have to look at how we can maximize it now. So it saves time and travel, is ideal for busy individuals, and even those that are not in underserved area, that are business executives that are so busy and they don't really have time to come and have long waiting time. So TELE-DENTISTry, that can be an easy access for even while at work. You can just have 5 minutes and you can have consultation and have prescription. Also, those that have mobility issues. That is cost effective. It's at a reduced cost for the patients and also for the providers. The timely care, it addresses urgent issues quickly. You are having pain, you don't have to travel all the way. That can be addressed, and the pain can be alleviated right at the click of the finger, and then provides guidance until an in-person visit. So many people, even in this environment, they'll say they have used battery water, that they have gone to traditional people to bring out worms. They've done all kinds of atrocities. They've used the astringents that cause a lot of harm. So this telemedicine would be an appropriate thing for them to do the right thing even before they can now come to the hospital. It also helps better management. It helps manage chronic conditions and follow up those that have malignancies, those that have fractures, those that have the orthodontic treatment that are long-time failures. And this is to follow them up instead of them coming for every visit. However, I want us to look at the situation analysis of Nigeria and see the burden of the need, why we need to really use TELE-DENTISTry to access care. In Nigeria, it has a mobile penetration rate of around 87%, approximately 172 million mobile subscribers out of a population of about 280 million. Nigeria is Africa's largest mobile market, with smartphone users accounting for nearly 66% of the total subscriber base, translating to over 140 million smartphone users. The coverage seems large when we look at this, 140 million smartphone users. But when we look at it in reality, how many of them have money to put in data regularly to be able to access care? So many of them just limit their smartphones to ordinary phones. The World Bank affirms that 84% of adults in Nigeria own personal mobile phones. In 2025, estimates show that about 55 to 66% of Nigerians use smartphones. One report estimates around 140 million smartphone users in Nigeria, which is about 66% of mobile subscribers. So this is something that can be leveraged in assessing care. Other industry estimates place smartphone penetration between 44 to 55% of the population, and this is about 2024 to 2025. So when we look at the population of Nigeria, and one can have access to them, you can see that oral health care, oral health education, oral health services can approximately reach 140 million. That's like half the population. However, there's still a challenge. You find that when you look at the urban versus rural, urban areas have higher smartphone of more than 59%, while rural areas are much lower, less than 26%. So this is the challenge. The rural areas are where dental clinics are not located, they don't have access to the physical clinics, and now they are also disadvantaged, they don't have access. Less than 26% of them have access to phone. So this now brings a challenge. However, increasingly, more people are beginning to have smartphones. The growth is driven by availability of cheap Android phones like Techno and Infinix, which is good for TELE-DENTISTry access. So we're just hoping that they keep on lowering the price, then the rural area can have greater access to internet facility. How about dental clinics in Nigeria? As of 2025, estimates show that Nigeria has roughly 800 to 915 dental clinics nationwide. So when you look at a nation as big as that, and having this limited number, you can now know that we have a big problem with access. Some states with the highest number of clinics, like Lagos State, out of the 800 to 9, Lagos State has roughly 300. So Lagos State holds about 35% of all dental clinics. So we can see gross need, enormous need, TELE-DENTISTRY. The federal capital territory has like 91 to 105, or your state 57. So just find out all the, and there are 36 states, including federal capital territory. So this shows us that in terms of physical access to dental clinic, it's very poor in Nigeria. TELE-DENTISTRY might be the solution. And many of these clinics are small single owner practices. Many of them are solo practices. Like more than 91% of them are solo practices. If you look at this graph, it brings into reality what is on ground. In 2020, the total number of dentists is 1,650. Population about 200 million. In 2021, it rose to 2,165. In 2023, we have a population of 3,122. So when we look at that, Nigerian population, know that we have big work ahead. And also, we look at the dentist to population ratio. According to WHO standard, dentist to population ratio should be one patient to be one dentist to 10,000 patients. 10,000 population. That should be the ratio, 1 to 10,000. But what do we have here? In the Northwest, 1 to 254,000. In the Northeast, 1 to 224,000. In the Southeast, 1 to 195. North Central, 1 to 117. South, 1 to 74,000. Southwest, like, we even think it's well reached. It's still far to go. 1 to 10,000 population ratio. So building TELE-DENTISTRY will be the solution to accessing oral health care. This graph is showing number of dentists by gender. So now, what is the motivation for TELE-DENTISTRY in Nigeria? From the data that we have looked at, we find that there's gross limited access to dental care, especially in rural areas. When we're talking about the mobile phone penetration, rural areas less than 27%. We're talking about how access to physical clinic, Lagos alone takes 35%. And Lagos is just one out of 36 states, including federal. There's also shortage of dental professionals. We have seen the WHO ratio that should be 1 to 10. We're having 1 to 200 and something, some areas. The high cost and travel time for the patients. So this should be the motivation for TELE-DENTISTRY to actually be driven in Nigeria. And these are the proposals that should actually be sent to the regulatory agencies so that they can put in the technology, they can put in manpower and everything that we needed. Because this seems to be the way out. Nigerians are going to access good oral health. So what are the benefits? What are the expectations of TELE-DENTISTRY? Well, going to provide remote dental care. It's also an avenue to provide education to oral health education to patients, oral health education to practitioners, and oral health education to dental nurses, dental technicians that are also part of the workforce, that are part of the dental team. Then it's one of the benefits is helping in connecting patients and providers, either by phone, video, or different teledentistry apps for virtual checkups. I take the masters in the community health class, and year in and year out, when I ask them how many of them have ever been to a dental clinic, out of a class of about 20, maybe 2 or 3 of them have said they've ever been to a dental clinic in their life. So even those in urban areas, those are supposed to be health practitioners, they're not accessing. So teledentistry will actually be a tool once to be able to engage all manner and all categories. So it helps in diagnosis, treatment planning, and follow-ups. Especially, I am an orthodontist. Our treatment takes as long as 2.5 to 3 years. And these patients have to be coming every 6 weeks. But there's sometimes that they don't need to come. Teledentistry is in place. We can use it. There are apps that can use it to remotely monitor them and even be able to engage them. Like sometime 3 weeks ago, a patient came. She said she took flights. 256 to come, and she will take another 250. That's like 500,000. By the time she came, there was no light, there was no water, there was no material. So she went back like that. With the application of teledentistry, those are pitfalls that will really be avoided. So it improves access, it's convenient, it's efficient, especially for rural areas. And it's also excellently good for emergencies. We have a lot of dental emergencies, lots of people in pain, and with the use of teledentistry, we'll be able to handle issues from general concerns to urgent pain management. So what are the benefits to the dentist? It improves collaboration with specialists. When you have all this data, you have all this radiographs, you can share with your colleague, even internationally, and they can draw a treatment plan for you. So you're just limited to those that are around you. It helps for efficient patient management. There are apps that can even help you with diagnosis and treatment planning. It helps in increasing service coverage, able to access more. It helps in practice success. And ultimately, all this will lead to more money, which everyone is looking for. So what's the Nigerian experience? Tele-dentistry in Nigeria is an emerging field that is accelerated by the COVID-19 pandemic. In fact, that COVID-19 pandemic got all of us to see the need for tele-dentistry with significant potential to improve access to oral care, especially for rural and underserved populations. While awareness among dentists is growing, particularly with the use of mobile technologies and apps, actual consistent use of formal tele-dentistry platforms made relatively. Many practitioners relying on informal, non-structured methods like social media. People depend on WhatsApp, voice call. In a study that was carried out on teaching hospitals in Nigeria, they found that out of the 199 dental practitioners that participated in the questionnaire, 62.2% of them do not currently utilize tele-dentistry. So there is the need, to start incorporating tele-dentistry in the undergraduate dental curriculum, so that right from undergraduate they get conversant with it, and they get conversant with right from undergraduate level. That would translate to better usage by the time they graduate. Less than half of them, that's 42.6%, had internet access at work. That's one of the challenges that background with internet access at work. 12.5% of them with internet access only at home utilize dentistry. We now find that cell phones and personal computers are the only devices used. Like 62% of participants in the public health care, they're using their cell phone for dentistry. Majority of the study participants agree that teledentistry can be used to connect patients with specialist care that may not be readily available. Only 47.1% agreed to the use of teledentistry for specialized care of patients. We are just looking at the challenges that specialized care may not be optimal. 84% agree that the cost of telecommunication equipment for teledentistry can be a cause for concern, and 66.4% agree that privacy is still a concern in teledentistry. Since the government has not really brought out real regulations on it, privacy of health records can be challenged. What are the implementing strategies that have been done? Mobile apps and online platforms have been developed. Lots of user-friendly apps have been developed for patients to connect with dentists. Also, training program for dental professionals has also been done. There have been education of dental professionals using tele-dentistry. Also, partnership with telecom companies and NGOs. That is very important, because in collaborating with telecom companies and NGOs, that will greatly help to promote teledentistry. We're talking about rural areas that have coverage of less than 30%. Collaborating with them can help to improve access. That can be part of their community service. They're making, every year they record profit of millions of naira. So that part of their community engagement and giving back to the community can be access to designated rural areas. We also developed an app, the Fan Connect, in Ilorin here, able to help with teledentistry. The Fan Connect was an app that was developed by a team that was based in the University of Ilorin during the pandemic. And there was a collaboration with a private consultancy. And the team included a pediatric infectious disease expert, a public health expert, an orthodontist, which happened to be a person, a computer scientist, and a mobile application developer. So the Fan Connect worked to produce what we called Fan Connect, and it was made for patient consultation locally domiciled in Ilorin, but it was also used to consult with patients from anywhere and everywhere globally. And then the proposed app's name is I follow up, and the proposed app's domain as follows. It's still developing, and we're looking forward to it working effectively to be able to improve access to care. So these are the faces that the Fan Connect app, the teledentistry medicine app that was developed. These are the stages went through. But it's also incorporated dental consultations. There are some teledentistry apps that are also being used currently, globally and also locally. Dental monitoring. See, and what this dental monitoring does is that does remote treatment oversight, does visual progress tracking, it enhances patient engagement, it's time and cost efficient. So if you look at it now, this is showing the patient in occlusion, and we are able to see the occlusal features. So dental monitoring, what it does is a patient journey in the virtual era. So it's carried out by SmartMate, Vision, and dental monitoring. And what does it involve? There's an initial virtual consultation and followed by first in-office visits. And then you have the monitoring, pre-treatment monitoring, the weekly virtual checks-up, monthly virtual checks-up. For the initial virtual visits, the patient doesn't need to be seen. So after the initial virtual, I have the first in-office visit. Then from the first in-office visit to the post-treatment retention monitoring, the patient only comes when it is needed. What is done mostly is monitoring. So the pre-treatment monitoring, weekly virtual checks-up, monthly virtual checks-up, retention monitoring when the treatment is completed and give a retainer. So all these are treatment monitoring, and all these are done virtual. They also have post-treatment retention monitoring. So the patient only comes for the first in-office visit and occasionally when in-office visits are needed. So it saves a lot of time, it saves costs, and patient is happy, practitioner is happy. What are the challenges and solutions? Internet access. The Farm Connect that we said we developed, one of the main challenges we had was that, a lot of people that wanted to access, whether they had poor internet connectivity or they couldn't afford data. So limited internet connectivity is a big problem in some areas. So the solution will now be partnering with the telecom companies. Another big challenge is regulatory framework. There's no clear guidance on tele-dentistry. So there's a need to collaborate with regulatory agencies, Federal Ministry of Health, and all these other regulatory agencies to be able to know and bring out the standard protocol on how to go about it. Then there's also shortage of dental professionals. Like you said, WHO standard is 1 to 10,000. Establish more dental schools, but you now find that even the present dental schools, like last year was catastrophic. The dental school in Jos was closed down. The dental school in Alabama was closed down. Most of the students had to be sent to other dental centers because they didn't pass accreditation. Ideally, maybe they're not supposed to admit less than 100, and we're admitting 500, and they didn't have enough equipment and professionals to take them through. So that created a real big problem. And another thing that starting a dental school is real capital intensive. The first 4 years, you're going to do everything like medical students are doing. And so all the facilities for a medical school is needed for a dental. You now have additional things that you now also, and a dental chair can cost 7 million and above. You need a phantom head for every student. A phantom head can be like 7 million and above. So by the time you look at this, it's really capital intensive setting up dental schools. Also contributing to shortage of dentists. And then this JAPA syndrome, a lot of the dentists are also leaving the country. At the last employment, we couldn't get any consultants. There was slots to employ like 10 consultants for us in UIT, a dental department. Well, it wasn't filled. Nobody came. So we have people want to go abroad, or they want to stay in Lagos where they feel that they'll get plenty of money. We saw from that statistic that 35% things are located in Lagos. So high cost and travel time are also those challenges that we have to grapple. So therefore, what lies ahead? There's a great future that lies ahead if you can harness, the beauty of tele-dentistry to be able to access. There is need for increased training of dental professionals. There is need to be able to expand telehealth infrastructure. There will also be the need for greater use during emergencies or pandemic. All this will be able to strengthen the oral health delivery if well implemented. We have seen that the traditional methods cannot take us far. We have seen the gross limitation, the shortage, the number of health professionals, the shortage in the number of dental clinics, the problem in the rural area where they don't have access. Less than 30% have access smartphones, and even those that have access, electricity. There's big problem with electricity. There's big problem with internet connectivity. So unless the government will expand this telehealth infrastructure, which will be at a cheaper cost, setting, because if they're going to set up universities to train dentists, the cost of it compared to the cost of building infrastructures for tele-dentistry is so less, and yet we're able to do so much more.
Sorry to interrupt now. We have just a couple of minutes now.
Oh, okay. So presently, we have locally used tele-dentistry apps that are being used among specialist dentists in Nigeria. We have the DRO Health, the Doctor Connects. The DRO Health helps telehealth app that connects patients with various specialists. The Health Connect 247 doctors. So dentists can use this platform. They're using this platform to be able to give oral health advice, try dental problems, and schedule in-person visits when necessary. So these are also the other apps that have been used. We also have some global dedicated tele-dentistry apps. They're used worldwide and they can be used anywhere. And to dental monitoring, SmartNet. Also, we have communication platforms that are being used by clinics, Zoom for healthcare, Google Meets. So in conclusion, we need to work together. We need to join the tele-dentistry revolution and improve oral health care in Nigeria. I therefore encourage all dentists to buy into tele-dentistry. I also encourage all doctors to refer and help patients to key in. So together, we can achieve a lot. Together, we can improve access to oral health care. Together, we can cause better coverage. Together, we can take our nation higher, the higher pedestal than the abysmal picture that we have. Thank you very much.
Thank you so much, Ma, for that beautiful delivery and enlightening lecture, bringing us to understand the healthcare gap in dentistry in the Nigerian health sector, and especially in the world of dentistry, showing us the immense gap that physical dental care cannot cover. I can imagine if in a place that has a lot of hands as Lagos, still having a dentist to patient ratio of 1 to over 30,000 patients, and the Northeast having 1 to over 256,000 patients. That's a whole lot of work that we can't bridge that gap in a long time. And that begins to raise a lot of questions in my mind. Looking at the chat box, I want to have, we don't have any questions for the speaker yet, but I have a couple of questions, Ma. Ma, you mentioned the thank you very much for that. It is available, the potential, the work that is done, and the work that is ongoing, and how we can all come in to partner with TELE-DENTISTRY to make it work. The role of the government, the role of the partnering with telecom giants, and also ensuring that unreached populations get healthcare. Thank you, Ma, for bringing that to our notice, and I'm sure that we have been enlightened this evening to what can be done to bridge this gap. But while I think our active listeners are gathering our thoughts, I want to ask Ma, with this population of unreached people and the potential dental and TELE-DENTISTRY holds to bridge this gap, how do we strike a balance to ensure that our dental professionals also have their private time and don't get a burnout? Because TELE-DENTISTRY now means you don't leave work at work. If we are working with the app and other follow-up visits, that means even the patient can follow you to your family time, to your home time, and you still get swamped. Even after seeing the physical patients during the day, you still have to attend to virtual patients. How do you strike a balance between that patient load when there is no opening, start time, or close time for work, as it were, with TELE-DENTISTRY? And also, you mentioned that starting up a TELE-DENTISTRY clinic has a high cost of initial cost of care. What is the basic minimum needed to start up a TELE-DENTISTRY on the part of the healthcare provider? What is the basic minimum needed to be put in place? Thank you, Ma.
Thank you very much for your concerns that you have raised. Presently, the workload and the stress is much. Let me just even talk about micro setup. In UITH, the dental clinic, we have I, as a consultant of orthodontist, facial surgeons, and one resident. So you can imagine the workload. So that raises concern that now incorporate TELE-DENTISTRY. How are you not going to get overstressed? So there are always boundaries. Whatever one is putting in, there will have to be boundaries. Like, it's not that they can have access to you whenever they like. So there will be that conversation. Then another thing is that we have dental health, dentistry, there's a team. We have dental nurses, we have dental surgery technicians. Like in my orthodontic practice in the teaching hospital, because the orthodontic patients, we see them for a long period of time, like 1 year, 2.5 years, or 3 years. So they don't always have to call me when they have a concern. I've trained the dental nurses and dental surgery technicians under me to be able to handle some things. So they can call in, they will be the first point to receive them. Whatever they can deal with, they just conclude with the patient. Whatever they cannot deal with, they now send the picture, tell the patient to send the picture and the complaint to me. How now it's happening. So with that, it's not everyone that is having access to you. It's those ones that they cannot handle. So on a national level, if this category of workers can really be given good education, be properly trained, so that minimal, minor things, they'll be able to access and they'll be able to handle those ones, and then the critical one can now get to the dentist. That will really help in reducing the workload. Because there's no avenue for this proper interaction and training, you find that many of the dental nurses and dental surgery technicians are just setting up clinic and doing a lot of quackery. So this TELE-DENTISTRY can help to really address that, give them first patient, let them know their boundaries, let have an efficient referral system. So even when people come to them, they can contact, there can be interaction with dentists. You can now tell them, these are the things you can do, these are the ones that you cannot handle, and the rest. So that will now reduce the stress for dentists.
Thank you very much, ma, for that. Yes, ma. Go on, please, ma.
Setting up the TELE-DENTISTRY thing is a capital intensive thing. Real capital intensive, because it involves a lot of technology. Then it also involves regulatory body. You have to get your registration. You have to have the app. Then you have to pay for the development of the app. You have to have a technical person that will be managing the app. So in our experience, you know, it has cost us some money, and where we're even stuck now is registering that app. Domain where the server that will be transmitted.
Wow. Thank you so much, ma, for that. There's a question on the group page that says, thank you, ma, for the inspiring lecture. I was excited hearing about the app developed in Ilorin. Is it still in active use? And how can other centers buy into it?
No, we're working at getting a grant from Central Bank, a 50 million grant from Central Bank, and that's what we're waiting for it to actually be able to really take off. So it's really capital intensive. If that grant comes in, then it can really now take off totally, because you really need to register the domain, and that is what is holding the next stage of development.
Thank you so much, ma, for that clarification.
For us, that the Central Bank,
we don't have any more questions. Wow, that's a lot of money, and I can imagine if our politicians and the executive arm of government takes it up to actually strengthen healthcare and dentistry, dental practice via TELE-DENTISTRY in Nigeria, that will go a long way to bridge the healthcare gaps we are having. Thank you very much, ma, for this beautiful, clarifying and elucidating lecture. I think this lecture is making us understand that as a country, we have a lot of work on our hands as regards our healthcare system, and especially in our dental care, being understaffed and has a lot of challenges facing us, though not insurmountable. A question just came in, ma. The last one will be taken for this lecture. Said, thank you for the lecture, ma. Please, what can be done to close the severe gap of inadequate manpower? These are these very small quotas for dental school. Hello, ma.
Well, can you come again, please?
The question says, thank you, ma. Thank you for the lecture, ma. Please, what can be done to close the severe gap of inadequate manpower? These are these very small quotas for dental schools.
Well, one of the things is that, you know, even the few that we have, they are going by the day. You know, I said that there was drive for employment, the hospital was ready to employ, and nobody took it up. All that they're interested in is JAPA syndrome. So that JAPA syndrome is a big thing. You know, I, as an orthodontist, if I practice in US, orthodontists are the highest paid health practitioner in US. So you can see how really tempting it is, you know. So those are the things that are taking people away. And secondly, dentistry is capital intensive, you know, even more than medicine, because you still need all the resources in medicine and then extra equipment, extra gadgets put into dentistry. So the government must have the willpower to be able to invest. That's why even the schools they set up, they couldn't invest in all the technologies that is needed, and that's why they're not being accredited, and those students are in distress, and they have to send them to different places to complete their training. So we need great willpower from the government to be able to provide all the infrastructure that we needed to create more dental schools. And then also, regulations so that the other partners in the dent happenings that to close this gap, these dental nurses and dental surgery technicians are setting up park clinics and doing terrible havoc to the population. And so many people don't know. They just think that anybody that settled there, and this dental technician just said, I will do procedure for him, gave him injection. How does an injection cause protruded teeth to be put back, to be corrected? So many havocs has been done because of this gap. So it's a real big problem that government needs to address. Set up more dental schools, regulate practice, create education for the other dental professionals so that they can do some minimal work to reduce the disease burden and be able to manage some of these simple cases.
Okay, thank you, Ma. I think Dr. Omokulu, please, you can just help us out. Maybe maybe our moderator is having issues with his network.
Yes, I guess as much, sir. Good evening, sirs and ma'am. Yeah, thank you very much, ma. We want to appreciate you once again for taking out time to explain and make all of us love dentistry all over, not looking so abstract from afar, and actually recognizing the gap. We really appreciate you, ma. God bless you, ma. So I think you'll be able to answer all our questions, and we are grateful. So, Dr. Ilori, I will hand over to you. If there's any other thing you want us to know before we draw the curtain for the day.
So we want to appreciate Dr. Ernest. Thank you so much, Ma, for the lucid presentation. It's really a eye-opener to some of us that have offered, I've never been to dentistry for at all. So I also want to appreciate everyone that is present on the call tonight. So briefly, I would like to welcome Dr. Hanning to kindly help us introduce the CMDA leaders that are currently on the call, as we normally do during the webinar session. So Dr. Hanning is the CPD director at the CMDA Nigeria office. So you are welcome, sir.
Thank you very much, Dr. Ilori, for that warm introduction. Thank you, facilitator, for tonight. We are very grateful, Ma, for this very lucid presentation and for taking us through. We want to use this opportunity to appreciate everyone for making it for tonight's meeting, and most importantly, also appreciate our leaders within the house. Starting in no particular order, but acknowledging the chair of the board of professional development, Professor Femi Ogundipe, who is also here with us. Good evening, sir.
Good evening. Thank you very much. Yes.
Thank you so much, sir. The VP West, Professor Simeon Olateju, who is also here with us. Thank you so much, sir, for being available.
Good evening, everyone. Thanks to our presenter for the wonderful presentation. Thank you, everyone. Thank you.
Thank you so much, sir. And our Deputy CEO, Dr. Ege Aye, who is also here with us. You're most welcome, sir.
Thank you very much.
Okay, thank you, sir. And quite a number of our chapter leaders also who are here with us. Thank you so much for making it for tonight's meeting. So once again, God bless you, ma. God bless you, sir. And hand over back to our CPD coordinator for the West, Dr. Ilorin.
Thank you so much, sir. I want to especially appreciate Professor Ayo Gumodede too. So he actually was immediate past Western Zone CPD director, and he's also the pioneer CMDA leader in UITH. Sir, you wanted to help us give just a short word, then you can round up the meeting for us, sir. So thank you, sir.
Thank you very much, CPD coordinator, Dr. Ilorin. Thank you very much for asking me to speak. We had a new chapter started in Kwara State University Teaching Hospital and the Ministry of Health and the Health Management Board, a combined chapter. So that is the new chapter. The UIT chapter, actually started before I became a doctor. So several generations of leaders have been there. I want to thank our mother, Reverend Dr. Mrs. Moninuola Ernest, for a very insightful and very deep lecture. Thank you very much. My Reverend Dr. Mrs. Ernest is one of our leaders in the UITH chapter. And together with her husband, Reverend Professor Ernest, they've been guiding lights and guiding hands for the chapter ever since my generation were in medical school. Indeed, Reverend Professor Ernest was once the secretary of the then NCCMDS Board of Trustees. It's a long history of relationship with CMDA, both as student members, then as doctor, leader, mentors, and then as leaders in CMDA doctors. So I want to appreciate the deep perspectives that have been shared tonight. It's amazing how much is outside your own field. Just when you think your own field is wide and all-encompassing, then it's actually a matter of the fact that you've not been to the farm of another person's father, such that you would think your father's farm is the largest in the neighborhood. I want to thank you, Ma, for opening our eyes. Indeed, some of our children can be encouraged to study dentistry. And the vast opportunities in that field for making impact and for reaching to the whole man, spirit, soul, and body. I think we've received a lot of insight about this tonight. Thank you, Ma. I want to thank our Vice President, VP West, for this opportunity as well to make these few comments. So if I may, shall we pray? Our Father and our God, we thank you for this opportunity to gather together this evening on the platform of the CPD of the Western Zone. Father, accept our thanks in Jesus' name.